Hi, my name is Lola and this is my daily patient reassessment video. So before I go into the patient's room, I'm going to check the electronic health record for any new lab values or any new or indicated orders that I will need to read. I will also check the doorway and see if there's any indications of infection or allergies I need to be aware of. And there isn't anything, so I can go in my patient's room. Hello.
Hi.
How are you today?
I'm okay.
Can you confirm your name and date of birth for me?
Audrey Zadunich, 10/26/2005.
Perfect. I'm just going to check your wristband. Okay. My name's Lola, and I'm going to be your nurse today. What brought you into the hospital today?
I've just had a really bad headache.
How long has this been going on?
Almost a week.
Okay, and is there anything that makes it worse or better?
Sometimes it helps when I'm in a dark room.
Okay, nothing that really makes it better?
Well, being in the dark room, nothing
Okay.
really makes it worse, I guess.
Would you say it's constant or intermittent?
Pretty constant besides when I'm in a dark room.
Okay. And is the pain concentrated to one area or does it spread?
Mostly the back of my head.
Okay. And would you describe it as sharping, shooting, dull?
Definitely like throbbing.
Okay. Good to know. I have this little pain scale for you. 0 is no pain and 10 is the worst pain. What would you rate your headache?
Probably a 5, right
Okay.
in the middle.
Perfect. I will talk to the provider and we'll see if we can get you some pain medication just to help relieve that. But for now, I'm just going to do a full body assessment on you. So since you came in today, we're going to start with a neurological assessment. So that's just assessing your brain and level of consciousness. And so I've been speaking with my patient, so I know that she's fully alert. So I'm just going to ask some questions to make sure you're oriented. So do you know where we are right now?
We're in the Casey Center.
Perfect. And what's the date today?
December 13th, 2025.
So do you remember my name?
Lola.
Perfect. So my patient is alert and oriented. So if she wasn't alert and oriented, I would have to use the Glasgow Coma Scale just to assess her level of consciousness. But because she was able to answer all my questions, I don't have to do that. All right. So I'm just going to do a couple tests on you. I'm going to have you look straight at me and I'll just measure your pupil size. Okay. Looks like 4 millimeters. The right and the left eye. Now I'm going to shine this bright light in your eye, so I'll just have you look at my nose. Okay. Great. So I was just checking how your pupils would react to the light, and her both right and left eye pupils were equal, round, and reacted to light and accommodation. Now looking at my patient, I will note that there's no facial drooping or ptosis. And have you had any difficulty swallowing?
No.
Oh, okay, good to know. I'll also note my patient's body position and facial expression, and I note that both are calm and relaxed, and she has good body alignment. Now, I'm gonna pull your sheet down just a little bit. Is that all right? We'll just check out your skin. I'm gonna note that her skin is dry, clear, and pale and pink. Okay. Do you have any numbness or tingling in your fingers or toes?
No, I don't think so.
Could you wiggle your fingers and your toes for me?
Yeah.
Okay, perfect. And no numbness or tingling after that?
Nope.
Okay. Now, I note that my patient has good hearing because she's been able to respond appropriately to all my questions, and also good speech articulation because, again, she's been able to respond appropriately and she articulates her words very well. All right, so now I'm just going to test for some muscle strength on you. So I'll have you make a fist like this. Okay, and I want you to push against me. Push against me this way. Push against me. Push against me this way. All right, and then I'll have you squeeze my hands. Perfect. I know that the patient's strength is 5+ in both her arms. And now we're going to do the same thing on your feet and legs. So we pull your blanket down. Okay. Push against my hands. Push against them this way. Okay, and push against my hands. Perfect. The patient has 5+ strength in both her legs and her feet. All right. Next, I'm just going to take a quick set of vitals on you. Is that all right?
That's fine.
Okay. First off, I'm going to use my temporal thermometer to get a temperature on her. Just right here. 98.1. Perfect. That's normal temperature. And next up, I'm going to listen to your apical pulse, which is right down here, for a full minute, and we'll get your heart rate. Okay. Let's stick my stethoscope right here, and we'll just listen to you for a full minute. While listening to her heart rate, I noted that my patient's heart rate was regular and it counted for a full minute, and it was 62 beats per minute. While I was doing that, I also counted your respirations, which I noted were unlabored and regular, and I got 16 per minute, which is all normal. Now we're going to get a blood pressure on you. This is an adult cuff, and since you're an adult, it looks like it'll fit perfectly. So I'll slide this on your arm. What we're gonna do is pump it up to get a systolic measurement. So this is gonna be an estimate of what her systolic blood pressure is. For now, I'm just gonna pump it up and I'll palpate the brachial artery. And once it stops, I will know that it's gone high enough. Okay. Okay. I noted that my patient's pulse stopped at 120, so I'm going to add 30 to that, and I will pump up the cuff to 150 millimeters of mercury just to make sure that I get the right number. So now I'm going to take an actual blood pressure. So we'll put my stethoscope on and we'll just pump you up one more time and give you a tight squeeze. Okay. Alrighty. Your blood pressure was 122/76, which is a normal blood pressure, especially for your young age. That was perfect. And I just have one vital sign for you. One more vital sign. We're going to test your oxygen saturation by putting this little pulse ox on your finger. Wonderful. Just give it a second. Okay, the pulse ox shows that your oxygen rate is 98%, which is good on room air. All right, my dear, we'll move on next to a respiratory assessment. And like I just checked, my patient's O2 saturation was 98% on room air, so I know that she wouldn't need any oxygen. But if she did need oxygen tubing, I would check the FiO2 here and compare it to what is in the NUR. And in addition, I would check to see if her oxy mask or nasal cannula was causing any skin breakdown, but I don't have to do that in this case. So first off, I'm just going to start by asking if you have a cough. So have you been coughing at all recently?
No, not at all.
Okay, that's good to know, but if my patient was coughing, then I would just ask if she's coughing up any sputum or mucus, and what color and how much mucus. But I don't have to ask that because she doesn't have it. Okay, I'm going to take a quick listen to your lungs. So I'm going to set my stethoscope on different parts of your chest, and then I'll have you take a deep breath every time I move it, all right? Okay, take a big deep breath for me. Okay, one more. Okay, I'm gonna go out a little lower. Okay, great. And I'm just gonna have you sit up. Okay, and now I'm gonna listen to your heart rate on your posterior, or your breath sounds on your posterior back. So we listened in 6 different places here, and then we'll listen to 8 places on her back. And I'll just have you do the same thing, please. Take a deep breath every time I move my stethoscope. All right, I'll let you lay back down. that was all we needed to do. Next up, I am just going to go and check out your heart, cardiovascular system, because that's important. And the first thing I'm gonna note is that she has an IV here, but the IV is not hooked up right now. But if it was, I would just want to check and make sure that the IV flow is correct and that the medication is also correct. But we don't need to do that because your IV is not hooked up. I'm going to take another listen to you, and I'm going to be taking to listen to your heart sounds. So there are 5 different places I'm going to be listening: the aortic, pulmonic, Erb's point, tricuspid, and mitral. So I'll listen to all those parts on your chest, and I'm going to listen to them twice with my diaphragm and then with my belly. All right. So I'm just going to pull this down, and then you'll just sit there and I'll listen to your heart sounds. Okay, wonderful. Now I'll do the same thing with my diaphragm. Okay, I know that her heart beat were regular, and I heard S1 the loudest at the apex of the heart, S2 the loudest at the base. So I noticed no irregular heart sounds. And along with that, on her lung sounds, I also noticed no adventitious sounds, no crackles or wheezes. And then her heart rate, I noticed no gallops or murmurs. Okay, now I'm just going to check the pulses throughout the rest of your body. So we'll set this aside. Okay, I'm going to pull this blanket down first for a second. Now we're going to palpate your radial pulse right here. You have this little pulse right here on both sides. And I'm going to feel for it. Okay, that one has 2+ strength, which means I can feel it and it's strong, but not too strong. Okay, I'm going to come down here and pull down your socks. Also feel the pulse right on your ankle here. And I'll do the same thing. That one is the same, so it's 2+, which is exactly where I want it to be. And this one's a little harder to find, but this is the dorsalis pedialis pulse. This one takes me a second to find, but I found it, and this one's also 2+. All right, while we're down here, we're gonna check for edema, which is gonna be a fluid buildup within your lower extremities. So I'm gonna check here on your legs, and I just press in, and your skin doesn't tent, it just goes right back to normal, so I know you don't have any edema. And I'm also gonna check on your feet and your ankles. Okay, wonderful, no edema was noted. One more thing we're gonna do while we're down here is capillary refill. Have you ever had this done before?
I don't think so.
So when I check a capillary refill, I press down on your feet for 3 seconds, or for a couple seconds, and then your nails will turn white, but they should immediately go back to pink as soon as I let go. Okay, wonderful. We'll put these socks back on. Capillary refill on the feet was less than 3 seconds.
Thank you.
Yeah, and speaking of your socks, do you use any Ted hose or anything at home, like compression socks?
No, not usually.
As long as you're up and walking around, we won't need to use any, but if my patient was at risk for deep vein thrombosis, I would make sure and check if their SCDs were working okay. Alrighty, let's cover you back up. And I'll do the same capillary refill up here. Your fingers. Alright. See how it just turns right back to pink, green, and white? Okay, wonderful. Now, I'm going to move on to, if my patient had an incentive spirometer or needed that for breathing, I would have to educate them on that and taking deep breaths. But since my patient doesn't need that and isn't post-surgery, I won't have to do that at this point. Okay, now I'm gonna move on to inspecting your abdomen. So we're just gonna check that out, make sure it's okay. I'm gonna lay you flat for that. Just relax. Okay, I'll raise you up to working level. The first thing I'm going to note on the abdomen is that there's no incisions or ostomies. Have you ever had abdominal surgery before?
I haven't.
Okay, if my patient did, they might have an ostomy, which I would need to be aware of, but she doesn't. So it is clear. I'm also going to note the contour of the abdomen. It is flat, not protuberant or anything like that. Alrighty, we're going to give your abdomen a quick listen. So I'm going to start in the right lower quadrant, and then I'll move counterclockwise, and I'll note vowel sounds in each quadrant. Upon auscultation, I noted vowel sounds in all 4 quadrants, and they were not hyperactive or hypoactive, they were just normal active. Alright, now I'm going to do some light palpation on your abdomen, so I'm just going to feel around for any masses, and I want you to let me know if you experience any discomfort or tenderness. Okay. Did any of that hurt at all?
No, that felt fine.
Okay, perfect. I'm going to raise your head up and we'll just ask you a couple questions.
Thank you.
Yeah. So here at the hospital, we have you on a regular diet. Have you been tolerating that okay?
Yeah, I think so.
Can you tell me what you normally eat in a day? Briefly.
Just like some meat and fruit and vegetables and carbs like bread or rice or something like that.
And you haven't had any issues with your diet?
No, I've been keeping it all down.
Perfect. Have you had any nausea or vomiting?
Nope.
Okay. Amazing. And how often do you have bowel movements?
Usually once a day.
Okay. When was your last one?
It was yesterday.
Perfect. I have this little scale for you. Can you show me which type it was?
Type 3.
Okay. Perfect. That is normal. All right. Next, we're going to move on to a skin assessment of you. So just looking at your whole skin. So I'm going to pull your blanket down one more time. I'll just take a look at your body. Okay. Upon inspection, I note that your skin is free of lesions. Do you have any hidden lesions anywhere that I should know about?
I don't think so.
Okay. I note that your skin is clear, clean, and dry, and no lesions. And I'm just going to palpate your temperature. Temperature is warm and equal bilaterally, and skin is dry. I also note that my patient has no foul odors and that she has proper hygiene, which I also noted when she came in. Her clothes were clean and clear. Okay, and next I'm going to test your skin turgor. This just is a check for how dehydrated you are. So I'm gonna take your arm and give you a little pinch. And if your skin tensed, I would know that you were really dehydrated, but it went right back to normal. So I know that everything's okay. Okay. Now my patient here is independent, so she isn't on bed rest, but if she was on bed rest, I would want to implement Q2 turns, which would mean we turn you every 2 hours, and also want to make sure the head of the bed was positioned correctly. In addition, if my patient was on a P500 bed or pressure relieving bed, I would want to confirm that everything's working just fine, but you're just on a normal bed, so we don't have to worry about that. And if my patient, again, was on bed rest, I would want to use a scale like the Braden scale to assess for skin breakdown. And this can be prevented by putting barriers between the skin and the bed. Okay. Next up, I just have a couple questions for you on your genital urinary system. So how many times a day would you say you normally go pee?
Like 3 or 4.
Okay. And when was the last time you went pee?
Like an hour ago.
Okay. Would you say your urine is clear or a little bit yellow?
Kind of like a pale yellow to clear.
Okay. So not cloudy at all?
No.
Is there any foul odor?
No.
Okay. And do you have any burning while urinating?
No.
Okay, perfect. I was just checking for some symptoms of UTI, but it sounds like you're good on that. And if you were having trouble holding in urine, with urine retention, I would bladder scan you just to see what's in your bladder. But since you just went to the bathroom an hour ago, I'm not going to do that. All right, next up, I just end this off. I have a couple questions on you for mobility. So how are you moving around the house? Do you have any troubles? Do you need any walking aids like crutches?
No, I move around fine.
Move around fine. Are you ever worried you're going to fall or anything like that?
No.
If my patient was concerned about being a fall risk, I would use a fall risk scale just to test how big of a risk they are. And there could be factors like if you're on a new medication, like morphine, or if you have a change in your consciousness, but we don't have to worry about that right now. All right, is there anything else I can do for you right now?
I don't think so.
You're good? Okay, I'm just gonna confirm that your bed is at lowest place. We'll put it down. I'm gonna make sure you have your call light, which I think, hold on in the back. And you can press this if you need anything from me.
Okay, thank you.
Yes, and thank you so much for your cooperation. I'll be back in a little bit.
Sounds good. Thank you.
Yes. Okay, thank you.